Health insurance, the public option. Welcome to Sound Endurance. My name is Kenneth Muirtor. I wanted to take some time to discuss the public option that's currently being presented. But not just that option, but also health insurance in general. The way in which we as a society have decided to pay for our health care costs. You know, a vote for a public insurance option is a vote against the current distribution of wealth within the society. You know, notwithstanding the current public options, I'm talking about public roads and, in fact, public transportation and public schools and the United States Postal Service, you know, notwithstanding those options, and without looking to detract from or support those options, we can see a clear difference between what is publicly funded today and the public funding of health insurance. I mean, for example, you consider public roads. Well, 90% of the interstate highway has been funded by federal funds. Okay, that's a public option. And no one is saying, at least I'm not saying, that we should not pay taxes, nor am I suggesting that taxes are bad and the government should have zero jurisdiction outside of the military. But yet you look at public education, and we're paying about $9,000 a year per student. And if the average class is 30 students, and of course I understand that's debatable, some would like to see that number cut in half, but at 30 students, at $9,000 per year, that's $270,000 a year we're spending publicly to educate 30 students. I mean, when we think of that, our bells kind of go off. Our common sense meter tells us that it doesn't pass our reasonability test. I mean, for example, a teacher earns about $45,000 a year on average, and there's about $950 per student spent per year in curriculum. And if you factor in the cost of a lease in order to house 30 students and one teacher and their curriculum for a year, you're looking at about $14,000 or $15,000. And then when you total that all up, it comes out to about $2,930 per year per student. I mean, that's 2/3 less than what we're spending now in a public option, as a public option, that is within the public schools, having them being publicly funded. And when you break it down as a cost per student, it's $245 per student per month. I mean, that's reasonable considering that, some of us spend between $90 and $120 a week just for daycare type services. So the costs are very similar to having two children educated to what you're now spending for one child to be within a daycare environment. And then, think of the Postal Service. I mean, the U.S. Postal Service, well, that's an independent government agency which relies on postage and fees to fund the operations. I mean, yeah, it has a monopoly on delivering the mail, but it does also face competition for services such as package delivery. But the difference is no one is forced to pay for postal service. And this service does not increase the cost of mail delivery. Health insurance, along with a public option for health insurance, does increase the cost of health coverage for everyone, including the uninsured. And that is unjust. I've done a series, a healthcare series, in which we spend some more time going into the individual items associated with the healthcare industry. And we're not going to take the time here to look at that. But, we also have to understand there is also personal responsibility. That individuals, through their individual choices, can in fact contribute to their declining health. And that in turn would force them to utilize health care services. But the difference is this: there being a pool of wealth that no single individual is totally responsible for creating, it removes some of the personal responsibility from that individual. Now, I'm not saying, and I don't think anybody is saying, that we'd like to see a fellow citizen suffer, even if they've made some poor choices. I mean, individuals make mistakes. We do make poor choices from time to time. But the issue is that individual who made a poor choice ought to have the ability, even within their poor choice, to afford health care services individually. They ought not to be artificially inflated because of a pool of wealth created by the collective. That is the difference. You see, access to health care should come from wages, and sustainable wages should be paid to every individual by their employer. I'm all for the government legislating a meaningful minimum wage applicable to all business owners. I mean, the government's role is to secure the right of individuals to do good. And you cannot do good if you have to sequester wealth from another individual in order to pay for the services that are required to sustain you. I mean, individuals cannot do good if they cannot pay for the services they need. You know, if you're a pharmaceutical company, you're any other healthcare provider, and you come to me and tell me that you can make my grandmom see, but it's going to cost me $2,000 a month. Friends, that's no solution. That's extortion. Okay? Matter of fact, when you look at it in light of the free market, you know, we understand that exchanges are not necessarily free. And many are coerced. If a robber threatens you with your money or your life, your payment to him is coerced and not voluntary. And if he benefits at your expense, it is robbery, not free markets. That actually follows the mercantilist model. The robber benefits at the expense of the coerced. Exploitation occurs not in free market, but where the coercer exploits his victim. Friends, that's not my definition. That's from the econlibrary.org, the free market definition and explanation. See, in a system like that, in the system of health insurance, you're not driving innovation, you're driving profits at the expense of everyone. You know what? We cannot afford to leave the president alone in the White House. We must pray for him and for all those in leadership that we might lead quiet, peaceable lives in all godliness and honesty. We have to stand up individually and encourage the president to do that which is right and just. We must encourage that every American have access to sustainable wages. Matter of fact, I've done a sermonette series on wealth and wages in which I go in a little more depth regarding those subjects. But listen, a public vote, a vote for a public insurance option, is a vote against the current distribution of wealth. I mean, let's stand up and do what is right individually. Let's not sequester wealth from other individuals that we might secure the right or the hope to affordable health care, when in fact it is the very insurance model which has skyrocketed the cost of health care and made it unaffordable to the masses. God bless.